Hello everyone, in this video we're going to be discussing factors affecting interstitial fluid volume. Now the three factors that is going to affect interstitial fluid volume are going to be hydrostatic pressure, osmotic pressure, and capillary permeability. Now in this image, we see how these things are going to be tightly regulated by lymphatic drainage. So if we have an increase in interstitial fluid, for example right here, what that is going to do is it is going to increase interstitial fluid pressure, which is going to drive fluid into the lymphatic system, and the lymphatic system is then going to bring that fluid back into the vasculature. Here in this picture, you can also see how the hydrostatic pressure is going to drive fluid into the interstitial space, and we see how oncotic pressure is going to bring fluid to the vasculature from the interstitial space. Now let's do a question. A 53-year-old man comes to the office with progressive exertional dyspnea. He has smoked 2 packs of cigarettes per day for the last 35 years. Physical exam shows increased AP diameter of his chest. Auscultation reveals decreased breath sounds and scattered wheezes throughout his lungs. Exam of his extremities is unremarkable. Echocardiography reveals moderate dilation of the right ventricle and increased central venous pressure. The absence of peripheral edema in this patient is best explained by which of the following compensatory mechanisms. Now, this patient has right-sided heart failure due to COPD, which is called cor pulmonale. With right-sided heart failure, what we get is this increase in central venous pressure, which is the pressure that is going to be building up close to the right atrium, so the blood returning to the heart. And so with right heart failure and COPD, what we need to know is that the way COPD is going to cause right-sided heart failure is that the lungs are going to vasoconstrict in order to send blood to areas where it can be best oxygenated, and so this pulmonary vasoconstriction is going to ultimately cause the right ventricle to hypertrophy, as we can see over here. And the reason for this is because it is going to increase the pressure in which right ventricle has to pump against in order to send the blood into the lung, and over time this can cause right-sided heart failure. And so our answer is going to be B, which is increased tissue lymphatic drainage. So initially what we have is with right-sided heart failure, we can have this increase in fluid building up in the interstitial space. And so initially we can have that fluid returning to the vasculature through the lymphatic system. When the pressure in the interstitial space builds up, we can send that fluid into the vasculature through the lymphatic system. But over time, that is not going to be feasible. It's not going to be due to decrease in aldosterone levels, and the reason for this is because with heart failure, we're going to have an increase in aldosterone levels. It's not going to be due to an increase in plasma oncotic pressure, because COPD does not have anything to do with the increase in oncotic pressure, and it's not going to be due to decrease in interstitial fluid pressure, because that would actually cause edema.